Hello and welcome to 12's Health. I'm your host, Dr. Derrick DeSilva. Weight loss is not just about looking good. Severely obese people often suffer from chronic diseases such as diabetes, high blood pressure, and cholesterol, and heart disease, among other things. Weight loss surgery is a serious decision to consider, but a new type of surgical procedure can make the decision a little easier for some people. My next guest is Dr. Seun Sowemimo. He is a laparoscopic bariatric and general surgeon at Central Jersey Bariatrics and Prime Surgicare in Freehold. Also with us is one of his patients, Karen Fabiny. She had success with the new procedure we want to talk about called the gastric sleeve. Thank you both for being here today. Dr. Seun, I'm going to call you Dr. Seun, okay? That's okay?
That is fine.
That's all right? Good.
Absolutely.
Let's start off with some of the, what we call in medicine, comorbidities, some of the issues with being overweight. I mentioned some of them, cholesterol, blood pressure, diabetes. Can you just elaborate on that just a bit?
Yes, of course. High blood pressure and diabetes are far the most common things that are associated with morbid obesity. But there's other things like sleep apnea, like osteoarthritis of the knee joints, and some things that people don't think about. There's also psychosocial well-being of the patients that is affected by obesity, not to mention even disability with everyday functions of life and the like. There's also some things that are not thought about, like cancer of the esophagus, cancer of the breast, cancer of the colon are sometimes associated with obesity.
And that is a great point, because we don't think about osteoarthritis, and we don't think about the cancer issue, which people need to be aware of, because again, breast cancer and all of those have been linked to all of those issues. What makes, who's a candidate for this procedure, by the way?
Yes, to be a candidate for bariatric surgery or weight loss surgery, we have to look at the BMI. The BMI is a number we derive by taking the weight in kilograms and dividing that by the height in meters squared. And then we get this number. If that number is above 35, then that person is a candidate for weight loss surgery. If it's above 35 and not yet 40, and you have some of these comorbidities we mentioned, you are a candidate. If it's above 40 without any of the comorbidities or with them, it doesn't matter at that point, then that person is a candidate.
Karen, where were you when you, first of all, how long has it been since you've had the procedure?
I had my procedure in June of 2010.
Okay, how much have you lost?
I lost 130.
All right, did you have diabetes, high blood pressure, or cholesterol? Do you have
High blood pressure. I was probably about 295 pounds averaging.
And how much did you lose?
130 pounds.
130 pounds. So, and the diabetes is gone?
I didn't have diabetes, just high blood pressure.
Excuse me, the blood pressure is gone?
That's
Sorry.
okay. Now I have high blood pressure. I'm off most of my meds. I'm still on one med. I was on 3 different meds.
Okay.
So.
Let's get into what this procedure is. We've got some video of what this looks like. And if you could just tell us what's going on here.
Yes, so this is
done laparoscopically,
laparoscopic procedure. So we use very small incisions, usually not wider than the width of a finger, and then we put in these clever laparoscopic instruments. So here you see a picture of the digestive system, and with the gastric sleeve, we focus on the stomach. The stomach can contain about 800 cc's.
And that's what's filling up right now.
That's what's filling up right now.
Right.
So in this procedure, the gastric sleeve, what we do is divide the stomach with a stapling device, and we kind of go vertically up and create what is like a sleeve, or what people would say is a banana-shaped,
that other part comes out.
Stomach.
You take that other part out?
That other part of the stomach we actually take out of the body, and that is very important because the way this works is twofold. First of all, we're going from a situation where you could say you were drinking or trying to fill up a beer mug, but now you're only trying to fill up a little test tube. So you can rapidly fill up that stomach to the top where you wouldn't feel hungry anymore. The other thing, how this works, is that taking out that other portion of the stomach removes a hormone called ghrelin, which is responsible for hunger. It's also responsible for appetite, especially for things like carbohydrates and starchy and fatty foods.
And Karen, when you had this procedure done, what was your recovery like?
I was out of work for maybe 4 weeks. It was a slow process. Like the first week you're on clear liquids to full liquids the next week, so you gradually have to increase.
Right.
And I thought it was really fast. Within that month, I went back to work. I'm a nurse, and I was walking. So I thought it was,
so
very
good
quick.
recovery, no major issues there. And doctor, could you please explain the difference between gastric bypass, banding, and this particular procedure called the gastric sleeve?
Well, in the banding procedure, let me start with that. What we do is we put in a medical device that goes on the top of the stomach. And what that does is that it creates a situation where there's a small pouch of stomach above the band, and that becomes your effective stomach. So when you fill that up and you feel full and you're no longer hungry. Okay. The gastric bypass, we actually create a small stomach pouch using a stapling device, and that also restricts the amount you can eat. And then we reroute the bowel and create a little bit of malabsorption so that not all the nutrients that are eaten are absorbed.
Exactly. Well, thank you so much for being here. Good luck to you.
Thank you.
Good luck to you. Keep up the great work.
Thank
and
you.
I thank you very much for your time today. Stay
Thank
with
you.
us on 12's Health. Folks, not everyone needs to resort to surgery to shred the obesity label. We'll talk to Port Authority official and former state senator who will reveal the secrets to his weight loss success after the break. Plus later, if snacking between meals are your weakness, we'll have some healthy options that are friendlier to your waistline. But first, your health bite of the week. Vitamin C provides lots of benefits, such as protection against immune system deficiencies, cardiovascular disease, eye disease, and even skin wrinkling. And it can be found in more foods than just oranges. Welcome back to 12's Health. I'm Dr. Derrick DeSilva. To look at our next guest, you would never guess that at age 22, he was so overweight, he had chest pain so severe, he was convinced he was dying of a heart attack. Bill Baroni is the Deputy Executive Director of the Port Authority of New York and New Jersey, former state senator, and now author of the book, Fat Kid Got Fit. And so can you. Thank you so much for joining us.
Thank you, Doctor. Good to see
You were 312 pounds at the age of 22?
I was, yeah. I finished undergrad and worked for about a year, and when I went to Duke University's Diet and Fitness Center, I checked in on that first day. I spent a month in Durham. I checked in that first day at 312 pounds. Every number that should be good was bad. Whether it was my triglyceride number or my cholesterol number or my blood pressure, and certainly my 312 pounds of weight. I will never forget seeing that number on the scale.
That's unbelievable.
Yeah.
What do you think drives people to overeat? What drove you specifically to overeat?
Actually, I don't think there's one answer to that question. I think actually the searching for one answer to that question, the one thing that makes people heavier, one thing that makes people obese, has gotten us into this this diet thinking cycle. I think there's probably maybe a limitless number. When you have millions and millions of people across the country, around the world, who are obese, yet we look for one solution to that problem. I think part of it is certainly genetic. I think part of it is psychological. I eat when I'm happy. When I was a kid, if I was happy, I ate. If I was sad, I ate. If I didn't know if I were happy or sad, I ate.
Right.
So it was a constant. So I think there's lots and lots of different reasons, which is why it's so important and why I wanted to write the book. If you look at in the world, and you look on TV or you look in a magazine, everyone's looking for that one solution to obesity or being heavy, that there's a pill or a shake or a machine or something, and this multi-billion-dollar diet industry exists to convince all of us who battle weight that if you just buy this one thing, if you just take this pill, you'll solve your problem. That's just not the answer.
Do you still battle weight?
Every day.
Why? Why do you say that?
Well, I don't think that battling obesity is ever something that ends. I mean, that's diet. Diet thinking is, and quite frankly, it was the thinking I had when I showed up at Duke, which is if I just, starve myself and drink this or eat that or exercise a little bit, I can lose weight and go back to living the life that I lived before. That's just not true. So for me, it is a lifestyle that goes on every day.
Yeah, coming into dieting versus lifestyle, I tell my patients this all the time. It isn't about a diet. It's about a lifestyle that you are going to adopt and adapt in order to stay healthy.
Absolutely right. You know, the most important moment, I write about this in the book, the most important moment I had at Duke, the most important moment that anybody could have when it comes to losing weight and getting in shape is not I needed to lose 130 pounds. Because I can tell you, when I showed up at Duke, I'd never lost 10 pounds over 130. It was the first pound. And when they explained that this is not about lose a whole bunch of weight and go back to living the way I had been living at fast food restaurants and 4, 5, 6, 10 meals a day, but it was losing 1 pound. And with the light bulb went on, I say, if you lose a pound a week, and you go to somebody and say, do you think you can lose a pound this week? Well, sure, I can lose a pound a week. After a year, you lose 40, 50 pounds in the course of a year. That's a dramatic difference in health and a dramatic difference in life.
And you know what I'd like to do is you have some great tips. And I was looking at these and I thought, I am right on track with you. Or, you know, we're both on track, which is what I love. And let's go through them. The first one you have, and I am religious about this with my patients, is never, ever drink soda. Comment on that and why.
Well, one of the things I talk about in the book is, you know, both sugared sodas and diet sodas. You know, in many ways, you know, chemically within the body, you become addicted to those sodas. So whether it's, you know, regular sugared soda, which obviously is often corn syrup, which is really bad, or even the diet sodas, it often serves as oh look, I'm drinking diet soda. I love to go out and you know, see people order a really large, very multi-thousands of calorie dinner. You know, you're sitting next to somebody at a restaurant, they have chicken fettuccine Alfredo and butter this and that, and I'll have a Diet Coke, as if the Diet Coke is going to balance it out, right? But that's part of diet thinking, right? Give me one drink that will solve it.
Right.
Far better options exist. Far better.
Like what?
Like water, for example. One of the other tips I talk about in the book is, now I understand people say, water. You've heard that for forever. Drink more water.
But people need to listen to that.
There's a reason why we've said it for all these years.
Exactly.
So drinking more water, almost never drinking soda. And I understand the absolutism of never ever is hard. You see it with your patients. I certainly see it in my life.
I mean, in moderation, once again. If you need to take a little sip of soda, okay, make it 2 or 3 ounces, which is important. What about a food journal? Do you like food journals?
I do, and it was something I kept sort of religiously when I was going through Duke.
Why is that important?
2 reasons. One, I thought more about food when I was losing weight than before I was, and that doesn't make any sense. But it required me to sit and say, what's my plan for the day? Remember, my goal is to lose a pound a week. So what was my plan for the day? How many calories are what's my workout? So it's good as you're going through it, but it's also good when all of us do. You hit a plateau, or you suffer a little bit of a setback.
And you have a plan.
I can go back.
Right, and you have a plan. I think that's
18 years
what's
later,
important.
I can tell you in February of 1995, I can go pull out the book on this date, 1995, and tell you what I ate.
You have a couple more. We don't have time to go through all of these, and let me just read them. Stay away from processed foods. When eating out, ask and you shall receive. There's nothing wrong with asking, and join a gym. I love all of those. Your book. What is it? What do you go through in the book, and give us the nuts and bolts of the book very quickly?
Very simply, part of it is my story, what it was like to be a fat kid. Next was my process going through Duke. The third part of it is what sort of common sense, a lot of tips that anybody can do that's not some expensive tip or pill or anything like that. And finally, a lot of public policy things that we can talk about to make all of us more healthy.
So the book is, once again, folks, the book is, where are we? Here we go. The book is Fat Kid Got Fit, and so can you. The author is, once again, Bill Baroni. Thank you very much for joining us.
Doctor, thank you very much.
Been a pleasure to have you on here with us. Stay with us when we come back. If you're already abandoned your New Year's resolution, which I'm sure you have, to lose weight and get healthy, our next guest will help you get right back on track. But first, here's a look at this week's Community Health Calendar. Welcome back. We talked earlier about changing your lifestyle to be healthy and lose weight. That's probably at least half of the New Year's resolutions made on the 1st of January. By now, near the end of February, those good intentions have often gone by the wayside. Here to get us through the rest of these cold winter days and not abandon our healthy habits is Lauren Cohen, a registered dietitian and clinical nutritionist. Thank you so much for being here.
Thank you for having me.
Do they work? Do New Year's resolutions work?
Usually not.
Why? Why don't they work?
People typically don't have the proper strategy in place, and without having the proper strategy, they typically don't succeed.
Well, I tell people that it isn't a pill, it isn't a diet, it's a lifestyle change, isn't it?
Absolutely. Making lifestyle changes that you can stick with is the key.
And let's get to what's on our table here right now. Drinks. I mean, so many people look at fluids, they look at drinks. What do we have here?
We have here on the right, we have a all-natural fruit-infused essence water. It's a water that's flavored without any artificial sweeteners, preservatives, there's no calories, and there's no sugar.
Now, is water, I mean, what's wrong with regular water?
Water is perfect. However, a lot of people tell me they get bored of the water, there's no flavor to the water, so this is a great alternative.
Okay. And these are the bad guys?
Those are the bad guys.
Lots of sugar,
Lots of
lots
sugar.
of inflammation, lots of diabetes problems.
Calories.
Calories. How many calories are in this? Do we know? There's a ton of calories in here. I know.
This one bottle has 240 calories.
Oh my goodness
and it's
gracious.
100% sugar.
That's crazy. What do we have here?
This is a Smart for Life green tea protein bar. It's really important that you have snacks throughout the day. And with our busy lifestyles, having a snack that's a great balance of protein and carbohydrates with healthy fats is key. It's made with canola oil, which has omega-3 fatty acids in it, which is good for our health.
And what do we have here? These are almonds?
Almonds and some dried fruit. No sugar added dry fruit.
Right.
If you don't want to have a protein bar, having some healthy fats and protein in the almonds with some healthy carbohydrates is really key to a healthy snack.
Do you know what I do? What I do is I have one of these bars, I have some almonds, and I mix the two together. That's what I typically do midday if I need to get through to something. And what do we have down here? This is for folks that are starting with a cold or a flu or something? What is that?
It's very hard to stick to your resolutions if you don't feel well. At the first sign of a cold, if you take one of these drops, it lessens the severity of the cold and helps to shorten the duration of the cold. So you can get back on the bandwagon with your exercise habits much quicker.
And what's in that little container at the end there?
This is an all-natural vapor rub. If you do get congested, it's very hard to work out. You rub this on, it helps to break up the congestion, provides relief, and it soothes you so you can get back to exercising.
And I saw that there's peppermint and a couple of things in there, right?
It's all natural, it's organic, and it's petroleum free, so it won't be sticky. You can put it on and put a t-shirt on right away.
Very good. Hey, thank you so much for joining us here. Thank you for this great information.
Thank you for having me.
My pleasure. And folks, thank you for watching 12 to Your Health. Have a great day. Until next time, I'm Dr. Derrick DeSilva, and may you always be blessed with good health.